Hello and welcome to episode 28 of the Rogue Health Economist. We are super excited this week to have some actual economists on the show talking about actual economic things that are happening in society. And I'm super excited to have Stanford professor Nick Bloom on the show today. Welcome, Nick.
Good day. Happy to be here.
So first of all, before we get into your work on COVID and your work on the lockdown, I see that you look like maybe you're in a spare bedroom. How is working from home? I know working from home is something that you've written on and you've produced research on. So how's working from home been for you?
It's mixed. I think relatively I've done pretty well out of this. I can't say I'm like loving it particularly, but I know I'm in the quadrant that's, I'm actually getting to work in a room that isn't my bedroom. It's in a spare bedroom, but there are only 42% of Americans who are actually able to work in their own room that's not their bedroom. So most people now, I think I ran a survey on this recently, something like 33% of people are sharing a room and the remainder are actually just working in their own bedroom. So that's a big upside. I have 4 kids, so that's made productivity hard, particularly my youngest, my 4-year-old, repeatedly bursts into the room. Comes flying in. And then the other classic thing with everyone's experiencing troubles with working from home, equipment. It feels like Mad Max world in that, I dropped my main laptop walking in from the garden and the hinge fell off. So I'm in my old laptop, but it's like searching around for tech that still works, everyone I speak to is in broken old things. And Amazon must be doing a fantastic trade in connectors, trying to connect I have this microphone, but can it connect into this USB slot? And so I'm as we're going through the podcast, I'm hugely in favor of working from home, but under COVID is pretty horrible. So there's pre-COVID when it was really rare. There's during COVID where it's very common for certain types of people. And there's post-COVID, which I think is the promised land where working from home will really take off.
Yeah, well, so tell us a little bit about your research on working from home and sort of what you probably thought you might have been excited about moving into COVID and why that didn't work out.
Yeah, so I did something unusual. For talking to health economists and health practitioners in general, it's actually easier. It's an easier audience to explain this to. So back in 2010, I had a student in my class called James Liang, who was the co-founder and at that point chairman of a massive Chinese company called Ctrip. They're like China's version of Expedia. And they had about, at that point, 15,000 employees. And they're headquartered in Shanghai, and office space is really expensive. So James wanted to see if they could shift some of their employees to home. And from talking to him, he was in an econ PhD class. He actually set it up as what's called a randomized control trial. So he took 500 volunteers from 2 divisions, and we randomized them by even on odd birthdays. So they drew a ping pong ball out of an urn in a big ceremony in Ctrip, and it said even. So if your birthday is on the 2nd, 4th, 6th, 8th, 10th of the month, you got to work at home for 4 out of 5 days a week for the next 9 months. And if it was odd, you had to stay in the office. So this is, it's not blind, but it's kind of like it would set up a drugs trial. And what we saw after 9 months was, before I tell you what we saw, he said, Ctrip's view in advance was they'd save a heck of a lot of money on getting, shrinking down offices in central Shanghai. But people goof off. So their assumption is people goof off at home, they'd fall asleep, they'd play computer games. So they were like, which are we going to, save more money on this rent, or are we going to find worker output drops? It turns out quite amazingly that output rose by 13% from people working from home, which is huge. That's like almost an extra day a week. The second fact is employee quit rates halved. So employees loved it. They're incredibly happy, the ones that have volunteered. And the third finding, which is negative for the employees, but less so for the firm, was promotion rates dropped from working from home. So promotion rates almost half from people on home-based working. But for the firm, profits were up massively and they rolled the whole thing out. And ever since then, I've been generally in favor of working from home until COVID.
And so the difference with COVID is really just that schools are out and it's not your everyday working from home. It's not just like it was before.
Yeah, exactly. So I think there's 4 big challenges for COVID. There's kids. Ctrip said no one can have kids at home. I have 4 kids. It's just super distracting, particularly kids probably under the age of about 10.
Yeah.
The second factor is you're having your own room. So Ctrip said, and I've visited lots of firms over the years that have done working from home, is Ctrip said you have to have your own room and it has to not be your bedroom. And right now, less than half of Americans have that. Then there's, facilities, so connectivity. Again, from survey evidence, something only like 76% of Americans have proper working internet at home. So you had to have proper internet. And then finally, it was full time. So with C-Trip, it was only 4 out of 5 days a week, and they all came in on that extra day, which was a big deal. And they chose to work from home. So under COVID, those of us that are working from home didn't have any choice, and it was full time. So those four make COVID working from home not fantastic. It's bearable. It's better than the alternative, but it's far from perfect.
Yeah. Well, look, I certainly experienced that. I have my 7-year-old here, and it's been good. We've been very fortunate compared to other people and other parents at at the school that my daughter goes to. I've sort of seen what their life is like compared to ours. Feel very fortunate. But I didn't really bring you on here to talk about working from home. I really want to talk about some of the new research that you've been doing. We had Dr. David Katz on this podcast a couple of weeks ago, and he talked just about his thesis of total harm minimization in COVID. And, I just wrote this book, The Community Cure, on loneliness and, the power of social isolation to essentially, drive health outcomes. And so I guess I wanted to dive in a little bit into sort of what you've been thinking about, what you've been working on. And maybe just some things, if we're going to go rogue in this Health Economist series, what are some ideas that you want to share that you feel need to be understood by policymakers, regular people, voters, in this next phase?
Sure, absolutely. So David Katz and I were both involved in a session about 2 weeks ago with a number of California health officials discussing on thoughts on the extension of the lockdown. And I pointed out something based on, the long line of economics and epidemiology literature about the mortality cost of the current lockdown. So I'll just go through some figures with you. So current estimates are something like 20 to 30 million people have lost their jobs from the current recession, and probably 10 to 15 million of them are permanent job losses, as in these won't come back within the next 6 months. So that's an enormous amount of job loss. And then you think, well, look, how does this translate into health outcomes? And there's actually a well-known literature on job loss and mortality rates. One of the most famous papers is by Sullivan and Wachter in 2009 in the Quarterly Journal of Economics, and it looks at mass layoffs in the early 80s in the US and matches it up to a rather depressing sounding data set called the Social Security Administration death files. So it has, if you're on, you don't want to be on this list. It has the list of everyone's social security number and a 1 next to it if you're dead. And so they matched the two of them together, and they showed that in the 80s, people that had permanent job loss suffered significantly higher mortality rates over the following years. And in particular, the year and the year after they lost their jobs, mortality rates more than doubled, and then they dropped down. But on average, for a 40-year-old man, a permanent job loss was equivalent to losing 1 to 1.5 years of life expectancy. And the impact was mainly on the first year or two, was mainly on what we call deaths of despair. So drugs, alcohol, suicide, and actually a big spike in accidents, which are probably related. It's hard to distinguish between, if you have a car accident, whether it's deliberate or whether you're, drinking, etc. But a lot of those causes. And then if you look from 2 to 3 years out, it drops off. The paper said, look, that's mainly because losing your job also generates long-run drops in income. So about 20% on average. And as we know, in the US, income equals health outcomes. So that says that these 10 to 15 million people that have lost their jobs, that's probably equivalent to something like maybe 20 million lost life years. And then the final thing is, if you know that COVID deaths typically occur about 10 years before the end of expected life. So that's equivalent to something like 2 million COVID deaths. Now, obviously, these have like massive standard errors around them, but it points out that the potential magnitudes of death from just the current extreme recession is similar to the kind of magnitudes people are talking about for mortality rates from COVID.
Yeah, it's super interesting. I guess at the very beginning, right, when you don't really know how bad the virus is, right, it could be Ebola and every other person could die. And if Ebola shows up, you really want everyone to be like hankering inside because it could save a significant number of lives. ultimately, then it started to be clear, one, it wasn't Ebola, and two, obviously the job loss claims start coming out on the first Friday of every month, and everyone starts to get a little bit worried about what's going on. So, if you were in the White House and advising, like, how does your advice on what the path forward looks like compare to, say, someone like Dr. Katz, who's arguing for total harm minimization and taking the social determinants of health very seriously with regard to, not just economic factors, but actually health factors too?
Yeah, so look, I want to be very clear. I was completely in favor of the lockdown. I completely agree with your sentiment. So if we roll back to when the decisions were being made in early March, we had no idea how serious coronavirus was going to be. And we also were, to be honest, dramatically underestimated the impact of the recession. So I agreed with that decision. I still think it was the right call at the time. It's harder to know in hindsight. We're not revisiting that decision anyway. But two things have changed since mid-March. One is coronavirus, at least it's not as deadly as we thought some of the extreme outcomes will be, some of the predictions. But the thing that I know much better is on the economic side, the recession has turned out to be massively worse than we predicted. I would say something like 3 to 4 times worse. I mean, now we're facing an enormous recession, the worst since probably the Great Depression in the 30s. So, given where we are, I think the policy advice is primarily looking forward. I would not suggest a second full lockdown, even if we have a resurgence of cases in the fall. I think it's just turned out with hindsight, the first lockdown that we're kind of coming out of now has just been economically unbelievably costly. And therefore, even if you're just trying to save lives and don't care about anything else, I'm not even sure that a second lockdown would actually save lives, because the economic damage is so extreme. So it's more along the lines of, contact tracing, more minor, less economically damaging procedures, spacing, but not a return to full lockdown, even if it flares up again in the fall.
Yeah, just I guess I'd love to get your thoughts as to maybe why you think that it was underestimated. Are there other factors? I mean, I can imagine things like automation. Maybe companies were thinking that they would move to some level of automation, and then this gave them an opportunity to do that. Or what are some other ways? What are some of the reasons you think why it was underestimated?
It's a good question. Early on, people were talking about an I-shaped recession that would be a rapid drop and rebound. And I think it's turned out it's just hard to have a rapid shutdown and reopening. So not all states went into it at the same time. There's international staggering. The shutdown, didn't instantly lead to a drop in disease rates as we thought it would. And so by the time you get to now, we're now almost mid-June. We've been shut down for 3 months and we're only slowly opening up. After 3 months, it's very hard to rapidly restart those jobs. So there's a long literature in economics about what's called hysteresis. So hysteresis is an idea from material science that if you say bend a piece of plastic, you can't bend it back into shape. There's a one-way street. And hysteresis is used a lot in economics to talk about unemployment. So the view is once you've been unemployed for more than 6 months, it's very hard to get back into work. And hysteresis is really starting to be an enemy of the recovery now, in that we've had a large number of people who are probably out of work for a couple of months. There are businesses going bankrupt, bankruptcy rates are skyrocketing, and it's just going to make it hard to recover that fast. So in some ways, we're both Brits. I have a similar thought about Brexit, that, why didn't they know in advance this was going to happen, that, Brexit potentially being so damaging. It's just, sometimes it's hard to make these forecasts. And it turns out the lockdown lasted longer than I thought we predicted, and has been more extensive and has been much more damaging. And, if you look back at the last 6 recessions in the US, going back to the 70s, recoveries are slow but steady. And I want to emphasize on slow. If you look at 2008, 2009, it took 10 years to recover 20 million jobs, which is basically back to trend. We're now down probably 30 million jobs. So there's just not going to be a recovery in 6 months. It's just fantasy. So maybe we should have thought about that in advance. I wasn't in the discussions early on. Again, don't get me wrong. I don't want to say we shouldn't have locked down. We didn't know what we were dealing with back then. So it's absolutely the right decision. But it's turned out to be economically far more costly than we thought.
Yeah, it's super interesting. What are some statistics that you've seen thrown around in the last month or so? Are there any statistics that sort of give you hope around a swifter return, given that it's a slightly different factor than drove other recessions?
Well, there's the economics and there's the medicine, and the medicine is still just incredibly uncertain. And I'm not honestly qualified to talk about the speed of vaccines. The one thing, I was involved in a big group session at Stanford University on Friday afternoon, which was fascinating. A number of my colleagues in the medical school working closely on this. One point that came out from this is it's incredibly hard to predict what's going to happen. The contagion rates and infection rates are very hard to forecast. And there wasn't a lot of optimism that the warmer weather was going to reduce infection rates. So there's some evidence for it, but it wasn't honestly seen as a first order issue. So the key thing is going to be behavior on, social distancing, hand washing, mask wearing, contact tracing, etc. Economically, there's still some debate. You notice that Wall Street has done incredibly well. The stock market yesterday reached, past its peak from beforehand. Actually, I had a couple of calls today on this with, investors. I personally, we can go into why the stock market's done well. One of the main findings is it doesn't reflect the US economy. The stock market is very heavy in tech, and tech is driving the rebound. So the fact that Wall Street is booming ahead is really not a great indication for the rest of the economy. It's good for the Bay Area, some California, but so I see it being a long, painful recovery. The other thing that's worth being aware of, just for listeners as well, is the implications of the stimulus. So the only reason it wasn't a lot worse was the Fed and the government stepped in with a massive stimulus program, which is great. They get, full marks for speed of response. The problem is we're being left with a huge government debt. So government debt is now in the US as a share of GDP is past the level we saw after World War II. And so down the road, probably not next year, but my guess is 2022 onwards, tax rates are going to go up a lot. If you're paying, if you're a higher rate taxpayer, be prepared for like a huge increase in taxes, I'd have thought, in 2022, 2023, because we've got to pay. Someone's going to pay for these stimulus checks that are going out now.
Yeah, absolutely. Yeah, that's super interesting insight into it. Where do you see the way that the majority of the population, like who are not involved in tech or don't get paid in tech or are having to use tech now just to survive, where do you see the shoots of recovery for middle America, or is that unclear yet?
No, so there are a couple of facts that are interesting. I've been involved in a lot of surveys with the Atlanta Fed, Chicago University, of what's going on in Stripe, the big fintech. So right now, actually hiring, so in the US, the levels of hiring is actually similar to levels before. What's driving the horrible jobs market is the enormous increase in layoffs. So in the last 8 weeks, firms laid off something like 15% of their total workforce. They're hired about 4%. We can imagine they're down minus 11%. So one thing is there's huge levels of layoffs. If you haven't been laid off by now, by mid-June, you're probably in much better shape. Most of the layoffs already appear to happen, and it looks like the labor market is healing. In terms of the hiring, the other negative thing is, A, there's net layoffs. B, if you look at where the hiring is occurring, it's pretty low wage jobs. They're not great jobs. There's a lot of Instacart driver deliveries, working in Walmart, working in Amazon. So the other grim statistic is, if you look at who's been laid off, it's much more across the board. There's a lot of graphic designers, marketing managers, salespeople, etc., technicians, dentists are losing, but it's right across the board. If you look at where the jobs are coming from, they are there, not nearly as many as laid off, but they're in the bottom end. So those two factors, coming back to my original point, why I am nervous about the mortality increase from the recession, there is a widespread pain across the US. One of the few things to cushion the blow has been the stimulus package and all the checks that have been sent out. But at some point, that's going to come to an end. A lot of the current government aid is going to taper out either at the end of the summer or in Christmas. So, the long haul is where things look bleaker. 2021, into early mid 2021, where the subsidy payments stop. That's where I think we could see real cost. And if you look at the academic evidence I mentioned, both from Sullivan and Wachter, but there's also evidence, for example, the impact of Chinese trade. And evidence from Sweden and job closures. The Chinese trade is related to something you probably discussed before, which is the opioid epidemic. One of the factors driving that was the collapse of manufacturing industry, which is in part came from the big, it's the Rust Belt recession, and particularly the automation and the competition from Chinese trade led to the destruction of a lot of manufacturing jobs. That's been heavily linked to the rise of the opioid epidemic, and more generally, the fact that life expectancy in the US actually fell for 2 or 3 years. So, the current recession could easily push life expectancy back down, could drop it back in America because of the economic impact. So COVID is a horrible, I mean, I don't, again, don't get me wrong. I think locking down was appropriate, but it's a medicine which has extremely painful and powerful side effects.
Seems like the American economy was a lot more fragile maybe than we thought it was, just from the top line numbers, with businesses falling away and moving in. That's just my sort of overview point.
Kind of. Another take was this is a recession by design. The US government asked people not to work. I mean, they quite explicitly, in fact, made it illegal to go into work for much of the workforce. So the numbers I can tell you is right now, 1/3 of Americans are working from home. So that will be both of us and, many of your listeners, because that's highly concentrated towards college graduates, are working from home. 1/3 of people are working on business premises, which is primarily people that are essential service workers, but also some that aren't covered by lockdown. And 1/3 of people are not working. And the final third, some of them are still employed, some are, asked to remain at home, others are on furlough or unemployed. But in that sense, 2/3 of us are no longer going to work anymore, either at home or on it. And so the government asked us to do that. And in that sense, you could, in a weird way, say, look, it's the power of the US government, or the state's government, local government, to shut us down. But it's had exactly the effect you'd expect. It's led to a catastrophic recession. The other thing to point out, not only is the current recession enormous, its speed is like nothing we've ever seen before. So just to give you a couple of figures, if you go from the unemployment rate in February of 2020 was 3.5%. That's the lowest rate in 60 years. We went from that to April, when it was almost 15%, the highest rate in 80 years. So we had this incredible speed of drop. And the only real comparison, as an economist, we've been looking in the data, is natural disasters. So Katrina, I mean, the closest thing you're going to look at was Katrina's hit on Louisiana. So if you look at the job figures for Louisiana, the collapse in employment after Katrina looks almost identical to COVID. So it's as if the entire US has been hit by one massive natural disaster. So that's another thing that's been very hard to deal with, is just the sheer speed of which the recession hit us, which makes it very hard to deal with it from policy. I mean, you're giving policymakers up in Washington, 6 weeks to deal with something. And it's just, as you know, from the horrendous political infighting and, arguing going on, US government does not work at speed.
Absolutely. Well, I guess the final thought, I just want to share, Nick, and for our listeners, is just coming back to the central equation which you shared, which is that that the health effects of recessions are significant. And I guess are there I guess one of the things I've been thinking a lot about is that typically when resources disappear, nature sort of resorts to community, right? Because you need the positive externalities of other beings to, essentially to be able to survive when resources go down. And I guess, part of what I wrote a book in January, which is called The Community Cure, which is about doing medicine in groups as an example to, have the peer-to-peer delivery of value. And I would just love to get your thoughts on, community solutions and their appeal. Like, are there ways in which community structures will replace market or government services because they can't be afforded one way or another?
Yes, I mean, I think as your book shows, importantly, community medicine is a great driver. And in fact, we're both Brits. I mean, I've seen this work very effectively in the UK. There's a lot of lessons. I mean, I don't want to push the NHS as the shining beacon of the future, but there's a bunch of lessons as well we can take. And I'm totally on board for community medical solutions. Economically, I think that's right. I mean, interestingly, another outcome of the current recession is we become much more localist by construction, because travel has just been shut down. So, the travel industry has collapsed. So a lot of production and services are being provided very locally. I'm sure, you, me, and many of your listeners have even been cutting their own hair, or had, actually, I got my 11-year-old, my 4-year-old to cut mine, which was probably why. Anyone that can't see it.
Last year, and I'm never going to do it again.
So, yes, I mean, the economy has become much less integrated. International travel has collapsed. Immigration has collapsed. Actually, I think that's a bit of a a hidden worry. If you go back to, the history of the US has been founded. Both of us are immigrants. A lot of Americans are, if you look in Silicon Valley, there's research from Harvard showing that just over 50% of founders of high-tech companies are immigrants. So we've shut off immigration. We've also really clamped down on trade. In the Great Depression in 29 to the 33, there was a big clampdown on global trade. It was called the Smoot-Hawley Act. It was very damaging. Our current president seems intent on doing that again. Without getting too political, one of the other things that struck me finally about community is it's unfortunate we're in such a polarized political environment right now. If you go back to 2008, 2009, the government, as in the Treasury under Hank Paulson, was very effective at a big stimulus policy. This time around, because the government is so polarized, basically the Fed has been running the show. So Jay Powell has been really the white knight, as in trying to fix the recession. But the Fed is very constrained. Without getting into details, the Fed can't bail companies out. It can only make loans. It's a bank. It's not a funding agency. And it can only really focus on big firms. That's one of the problems, is that Wall Street is doing fine because that's pretty much what the Fed can do. It can provide a lot of money to big companies. It can't go out into the high street and make loans to tiny companies, not very easily anyway. So polarized politics in Washington has actually made this recession worse because the government has been, I heard Greg Mankiw from Harvard defining the current policy as a passing, an emergency pass. So Stanford is no longer grading students. We're giving passes or fails. And he said, look, I give the current US government, an emergency pass. It's not great, but it's better than nothing. I think I'd say the same thing, but it could have been, unfortunately, a lot better if we hadn't been so polarized. So there's a definite lesson, you want strong government, you want united government, you want, community, as you say, right now, so what can we do? Communities and local governments and, local authorities can step in to fill some of that gap that's been left by the mess in Washington.
Absolutely. Well, Nick, thank you so much for being here, part of the Rogue Health Economist podcast. I'm very interested in sharing insight on just the, the health cost of economic factors. I definitely have seen just, if we're looking at the cost of chronic disease, ultimately chronic disease is a function of isolation, is a function of, like you said, getting fired. The breaking of a social bond, can lead to depression, can lead to all,
exactly.
Kind of things. And so I guess I just wanted to share this insight for our listeners. And, more than anything that, we believe certainly in healthcare that the future has to be community, because ultimately, someone's got to pay the bill. And as long as markets and government are the only two solutions, there's not going to be as much money around to pay for those things. And so we need to find innovative ways to, to solve problems. And I really appreciate all of the work that you're doing to bring these ideas out into the open. And thanks so much for being part of the podcast today.
Great, James. Lovely to catch up.
All right. Thank you. Cheers.
Thanks, Em. Bye.